This is the pelvic floor muscle report. There are a few key things you need to look at, and only a few are really important. What is the premenstrual phase? It refers to the muscle tone of your pelvic floor muscles when you are relaxed in your daily life. Generally, it should not exceed 4. The unit used here is 6.22, which means that the muscle tone is high when relaxed. Now, is this measurement taken from the superficial, middle, or deep layer? In the pre-resting state, if the pelvic floor muscle tone is high, is it the superficial or deep layer? Because what is this test? The probe is inserted deep inside to measure it. Let's first finish explaining what exactly these measurements are assessing. One is the tension of your pelvic floor muscles when you are completely relaxed. Another is the ability of your pelvic floor muscles to contract quickly. Another is the ability of your pelvic floor muscles to sustain a contraction. And the last is the level of tension in your pelvic floor muscles after exercise. Another aspect measured is how long it takes for your pelvic floor muscles to relax after contracting. Overall, they observe how quickly you can contract your muscles when asked to do so rapidly, how many seconds it takes you to tighten them, and after tightening, how many seconds it takes you to relax. Then they also have you hold the contraction for a moment without letting go. When you relax, they observe how long it takes you to fully relax and whether your muscle tone remains high after relaxing. These are the things being measured. There are also slow twitch muscles involved. What are slow twitch muscles? They refer to the deep layer of the pelvic floor muscles, while fast twitch muscles refer to the superficial layer of the pelvic floor muscles. You can think of it this way. Do you remember the proportion of slow twitch to fast twitch muscles? Slow twitch muscles make up 70%, which means they constitute the largest portion of the pelvic floor muscles. It's mainly the slow twitch muscles, primarily located in the deep layer. Do you know why this part is the largest? Because this part not only supports the internal organs, but also assists with breathing. So it makes up the highest proportion. In other words, this part is a very important component of the pelvic floor muscles. So this part represents the baseline resting state of the pelvic floor. Let's first look at the first one. Is this value high or low? The reference value for the following should not exceed 4, but this one is 6.22. That means its muscle tone is high, right? So is high muscle tone good or bad? It's actually not good. Next, let's look at the coefficient of variation for its rapid contractions. What is the coefficient of variation? You can think of it as its stability. The stability should be less than 0.2, and here the coefficient of variation is 0.07, which is acceptable. A rapid contraction score of 81 is really good, which means the ability for rapid contraction is excellent. This suggests that this person often practices opening the lid. He frequently performs quick contractions, and his rapid relaxation time is 0.36 seconds, which is less than 0.5 and also good. His average value for sustained contraction is also above 40. However, his relaxation time exceeds 2 seconds. His relaxation time exceeds 2 seconds, and his overall value for sustained contraction is greater than 40. All the upward arrows indicate values that are above the normal range. This is not a good sign. It means that his pelvic floor muscles are tense and require a longer time to relax. Moving further down, the endurance contraction shows that his muscle endurance is still acceptable and his stability is also fine. The post-resting time refers to the degree of relaxation of his pelvic floor muscles after exercise. The results showed that it was 7.41, which is much greater than 4. In other words, his pelvic floor muscles just can't relax. His pelvic floor muscle contractions are strong, but he can't relax them. Do you know why? He has done too many Kegel exercises with excessive rapid contractions. But he hasn't done enough eccentric training for the pelvic floor muscles. You also need to look at another important indicator, which is the surface electromyography, EMG, of the abdominal muscles. Under normal circumstances, values within 10 are meaningful for reference. Anything above 10 is not meaningful. What does it mean if the value is above 10? It means that when you contract your pelvic floor muscles, your abdominal muscles are overly involved. So up to this point, it's still fine. But here you can see it starts to fluctuate. However, overall, it's still within 10. So this result is pretty good. This person is a yoga instructor. This peak here, what does it measure? It measures her ability for rapid contraction. When assessing the ability for rapid output, what's the ideal situation? The best is for it to be even there. Shouldn't be one peak here and another peak over there. You see, this one here is lower, but the following ones are relatively more even. The first time, she might not have reacted in time. This part is about holding and maintaining. If you're supposed to hold it here, but it suddenly drops down to here, that means you're unable to maintain it at the higher level. For example, if you're asked to contract and hold for a few seconds after contracting, you're supposed to maintain it for as long as possible to see if you can keep it up. The later part is to assess how relaxed your muscles are after the entire test is finished. So these are the values being measured. If a person has high pelvic floor muscle tone during the initial resting phase, what problems might they have? For example, if they are constipated, is it because they don't feel the urge to defecate, or is it that they sit on the toilet but can't pass stool? In this case, it's because the external sphincter is too tight, making it difficult to pass stool. If it's urination, he might experience urinary hesitancy. If he drinks cold at night, he could even develop angina. Because his external muscles are too tense, he might have issues such as ischemia of the external area, and the skin in the entire external region may be in poor condition due to inadequate blood supply and poor circulation and metabolism. He could have a whole series of such problems. Now, if it's this person's slow twitch muscles, if his slow twitch muscle contraction ability is relatively poor, this person may develop visceral prolapse, hemorrhoids, and similar conditions. If the strength of his slow twitch muscles is especially weak, it can also lead to increased muscle tone in his external muscles, resulting in high muscle tone in the superficial pelvic floor muscles. What else might happen? The superficial pelvic floor muscles may remain persistently tense and simply can't relax. Now, if it's during the phase of rapid contraction, meaning the strength of his fast twitch muscle contractions is poor, this person may experience urinary leakage. If the counter contracts slowly, the table here is different for each hospital. The counter's contraction time is normally less than 0.5 seconds, but it takes nearly 3.5 seconds to close. What does this mean? It means that when you cough, you need to tighten it to prevent urine from leaking. By the time you react, urine has already come out. So the accountant must contract quickly. When I cough or sneeze, it closes and no urine comes out. The result should be less than 0.5 seconds, but in this case, it took 3.47 seconds to contract the pelvic floor muscles. So people like this will experience urine leakage when they cough or sneeze. This isn't because their muscles lack strength. It's because their muscle response is too slow. So you need to train the speed of their contractions. The faster you can relax after contracting, the sooner you can contract again for the next repetition. It will be faster. For example, if you sneeze twice in a row or if you keep coughing when you're sick, let's say you contract your muscles the first time you cough, but then it takes you 3 seconds to relax. If you cough again just 1 second later, right after the first cough, you won't be ready. So when you cough the second time, your pelvic floor muscles haven't relaxed yet, and you have to contract them again, which doesn't work. That's why some people don't leak urine the first time, but if they keep coughing, they start to leak. If you don't leak on the first cough, but do on the following ones, it means your muscles take too long to relax after contracting. You need to be able to contract quickly, relax quickly, then contract again quickly, and relax again quickly. Many people use this method to practice like interrupting urination in the middle of peeing, suddenly stopping the flow and then letting it go again. This can indeed train that function, but if you do it for a long time, you're more likely to get a urinary tract infection. So it's not recommended to train this way. That's why there are specialized pelvic floor electrical stimulation devices with different waveforms and frequencies designed to train your pelvic floor muscles for rapid contractions. These devices work at different speeds and frequencies, specifically to address urine leakage when coughing or sneezing. This specifically addresses the issue of weak rapid contraction ability in the pelvic floor muscles. But if someone has strong rapid contraction ability but weak rapid relaxation ability, can they train with this? No, they can't, because their rapid relaxation ability is lacking. So here you need to pay attention to both the contraction time and the relaxation time. You have to look at both of these aspects. But what's the main drawback? The main drawback is that you can't see whether the abdominal muscles are involved. So you don't know from this test whether the rectus abdominis is helping. Let's look at another example, see this one. This is basically a member's result. While the previous one was from a yoga instructor, this one is from a member. Look at the member's result. In the initial resting state, the pelvic floor muscle tension isn't high. It's 0.8, which is less than 4, and it's not very stable. It should be less than 0.2. When doing a quick contraction, it should be less than 40, but here it's 34. This means that its ability for rapid contraction, the superficial layer of the pelvic floor muscle ache, is weak. The time it takes to contract is still quite long, much longer than 0.5 seconds, and the relaxation time is even longer. So they can't contract upwards, nor can they relax properly. Their slow twitch muscle performance is also failing and unstable. Therefore, what symptoms might this person have? They might experience both urinary incontinence and hemorrhoids, as well as prolapse. They could have these kinds of reactions. The worse their endurance test results, the less able they are to engage in prolonged activities, such as running a marathon. They would have to wear adult diapers because their endurance is lacking. For example, if you ask them to walk across the Gobi Desert or do any activity for an extended period of time, they wouldn't be able to manage. They just can't handle doing something for a long time. In the post-exertion phase, you'll notice that even though their performance was poor at first, after finishing the exercise, the tension level of the pelvic floor muscles shoots up to this value, 4 times the normal level. When I see a report like this, I immediately know what's going on. This person has a severely low position diaphragm. The organs in his abdominal cavity have already pressed down into the pelvic cavity, and all the organs in his pelvis have dropped down. The deep pelvic floor muscles have completely lost their ability to resist. The work of the deep pelvic floor muscles has been handed over to the superficial pelvic floor muscles. So the superficial layer is completely damaged. This is how to interpret this report. And it doesn't even take into account his abdominal muscles. If he doesn't have abdominal muscles, this person is in worse shape. If your abdominal muscles are helping and you still get this kind of data, your condition is worse. If your abdominal muscles are helping and you still have these results, your situation is worse. So for most menopausal women, it's easy to see pelvic floor muscle reports like this. Many menopausal women experience urinary leakage and organ prolapse at that time. When they go to the hospital for an examination, the report you get is usually like this. The superficial muscles have no strength, and the deep muscles are also weak. What about this patient? As soon as this member saw it, her superficial layer is damaged, and the deep layer is also damaged. But she doesn't walk much, doesn't run, and doesn't jump. So the pressure on her pelvic floor muscles is low. She spends most of her days lying down, so the muscle tone of her superficial pelvic floor muscles during the pre-resting phase isn't high. Now, if this person goes to the gym to work out, and she might very quickly develop high muscle tone in the superficial pelvic floor muscles during the pre-resting state. In other words, whether it's the superficial layer or the deep layer, if the fist is damaged, if you just lie in bed all day, you might not have any symptoms at all. The symptoms I'm talking about are things like urinary incontinence or hemorrhoids, but you might experience, for example, a feeling of shortness of breath, or maybe your heart still beats fast. You might feel these things. However, you won't have obvious sensations like urinary leakage or organ prolapse, because even though it's damaged, you haven't put extra strain on it. You haven't applied additional force to it. This looks very professional at first glance. Look, all the values below are above 10. So actually, this isn't accurate because the abdominal muscles are involved. Let me show you this Onido. You know what kind of person this is? This person is a power lifter who specializes in weight training. Look, their abdominal muscle involvement is 49. So this has no reference value at all. What could possibly happen to this person? This person might experience things like urinary incontinence, hemorrhoids, or visceral prolapse. But their lung capacity is still quite high. In other words, lung capacity readings might also be misleading because for many people, the accessory expiratory muscles are overly involved. So your diaphragm might actually be positioned very low, but the lung capacity you blow out is still very high. So even with the same machine, I don't fully trust just one measurement. Even though you can force out a high lung capacity, if your resting heart rate is also high, it means you have severe compensation by the accessory respiratory muscles below the diaphragm. And at the same time, your resting heart rate can't come down. Also, if your OBOT test is positive and your pelvic floor muscle report shows that your abdominal muscle involvement is extremely high, even though your abdominal muscles are highly involved, if you look at your pelvic floor muscle data, you see this value is only 171, which is about a quarter of the other value, right? This system mainly trains the superficial muscles, doing a lot of Kegel exercises. And this is actually a Pilates instructor. This is a pelvic floor report from a Pilates instructor. She has done too much core training for the waist and abdomen and has done too many single leg support exercises. She has done too much transverse abdominis training, too many side planks. So you'll notice that her waist and abdominal activation ratio is extremely high. The strength of her superficial pelvic floor muscles is very strong, but the strength of her deep pelvic floor muscles is very poor. Can you see the difference between them? The stronger the superficial muscles are, the faster they are recruited, and the more they inhibit the upward movement of your deep pelvic floor muscles. So at this point, the stronger her abdominal muscles are, the more they press down on the pelvic floor, pushing the organs in the pelvic cavity outward. Have you noticed that even during the pre-resting phase, the tension in her pelvic floor muscles is already high, but her deep pelvic floor muscles are weak? Why is that? Because the superficial pelvic floor muscles are doing the work of the deep pelvic floor muscles, and the organs within the deep pelvic diaphragm are already forcing the superficial pelvic floor muscles to contract continuously. But even during the premenstrual phase, when the pelvic floor muscle tension is already high, if you test her rapid contractions, you'll find that the strength of her rapid contractions is still quite strong. That's what I mentioned yesterday. If your deep pelvic floor muscles are not activated, the resting tension of your superficial pelvic floor muscles will be high. At this point, the more Kegel exercises you do, the more your pelvic diaphragm will be inhibited, and the higher the resting tension of your superficial pelvic floor muscles will become. So in this situation, what tends to happen, pain and over time other issues can easily arise. For example, certain inflammations of because prolonged contraction means a lack of blood supply. This means that its blood supply is poor. It also means that it cannot relax. In this situation, it's quite difficult to train breathing exercises because the abdominal muscles are too strong. You need to find a way to inhibit the abdominal muscles and the superficial pelvic floor muscles so that the deep pelvic floor muscles have a chance to activate. So when you look at girls like this with the naked eye, their body shape is usually very good. Why? Because their waist and abdomen are very strong. So their abdominal muscles are well defined, their waistline is very clear, their whole body is slim. They have very stable single leg support, and their movements look very graceful. Because her core in the waist and abdomen is strong, she can perform quick exhalation, abdominal contraction, and pelvic floor lifting movements. When she contracts her abdomen and lifts her pelvic floor, it's a combination of her abdominal muscles and superficial pelvic floor muscles. Each time she practices exhaling, contracting her abdomen, and lifting her pelvic floor, she does it with fast, forceful exhalations and strong pelvic floor lifts. This always trains only the superficial pelvic floor muscles. Now, after finishing this course, you'll be able to tell when you watch people exercise which ones are suppressing their pelvic floor muscles during training, and which ones are actually engaging their pelvic floor muscles along with the rest of their workout. Before, you couldn't really understand or grasp the underlying principles, but after working with more clients like this, you won't even need to look at their reports. You'll have a general idea of what their report would show just by observing them. So for this person, if your pelvic floor is being suppressed and you do too many suspended weighted sit-ups, especially if you inhale on one rep and exhale on the next, your pelvic floor will become increasingly suppressed and the tension in your superficial pelvic floor muscles will keep rising. Meanwhile, your diaphragm will keep dropping lower because when the upper half of this arc sinks down, it needs the lower half to contract and bounce it back up. But if the lower half is completely suppressed, it can't do that. The top is suppressed by the abdominal muscles and the bottom is suppressed by the superficial pelvic floor muscles. So it ends up that despite all the core training you do for your waist and abdomen, your body needs more oxygen for all that exercise. But you can't exhale properly. You can only increase your breathing rate. That's why this person's resting heart rate will be high and their lung capacity will also be high. When both are high, both lung capacity and heart rate, it means that the lung capacity is falsely elevated. So when both lung capacity and heart rate are high, which one should you trust? Trust the heart rate. The lower your breathing frequency, the lower your resting heart rate tends to be. Your lung capacity is just measured once, but your heart rate is continuously monitored, and continuous monitoring is more accurate than a single measurement. So don't get complacent just because your lung capacity test shows 5,000 or 6,000. If your pelvic floor is inhibited, the higher your lung capacity, the harder it is for your pelvic floor muscles to engage. If this report is about you, if you receive a report like this, the higher your lung capacity, the harder it is to train your pelvic floor muscles. What does this mean? It means your abdominal muscles are also inhibiting your pelvic floor muscles, and the superficial layer of your pelvic floor muscles is also inhibiting the deeper layer of your pelvic floor muscles. At the same time, your diaphragm is still in a lower position. So with all these issues combined, trying to activate both sides of your pelvic floor muscles becomes quite a difficult task. Now, you can understand what this report actually represents. This is something you can easily find online. It's a pelvic floor muscle report. Generally, a passing score for the pelvic floor muscle report is 85, but for coaches, I usually set the requirement at 85. What does this score of 85 mean? It means 85 points for each individual item, not a combined average score of 85 for everything together that would be meaningless. For example, if your other scores are high, like your counting score is high, your forward phase score is high, and your post-resting score is high, but only your slow twitch fiber score is very low if the most important one is low, but the others are high enough to bring the total score above 80, that still doesn't count as passing. Because what I care about most is the slow twitch fibers. I'm looking at your pelvic floor because this is related to your knee support. And it's also connected to supporting your internal organs. The accounting part is responsible for urinary leakage. If someone has urinary leakage, I look at their accounting score. This is something that gets checked at the hospital, but after testing and then doing electrical stimulation and manual therapy, sometimes the score on one side is even lower. In reality, it's not the hospital treatment that's the issue. Equipment just isn't effective. It's also not that the doctor's technique is bad. It's that they don't really understand what's going on with the patient's pelvic floor muscles. If the problem is with their slow twitch muscles, then electrical stimulation won't help, because you have to help them adjust their breathing. The brainstem needs to be able to control the pelvic floor muscles, and they need to be able to properly adapt during weight-bearing and breathing processes. Only then is it possible for them to improve. Otherwise, if you just have them do a bunch of contractions as instructed, not only will it have no effect, but sometimes their scores might even get worse after the exercises. Or issues like urinary incontinence and hemorrhoids persist no matter what methods are tried. That's because what they're lacking is the underlying logic I've been talking about since yesterday.